Directional terms are very important in anatomy, and they're probably the medical terms that you'll become the most comfortable with. They are standard across all disciplines, which is great because everyone then knows what everyone else is talking about. The first thing to remember is anatomical position. Anatomical position is very important. This is anatomical position. The hands are at the side, slightly away from the body, and palms are facing forward. This way you can see that the thumb is on the outside or the lateral side of the hand. It doesn't matter if my thumbs are like this, or if I cross my hands over my body, or put my hands above my head, or I turn around, or I do a handstand. My thumbs are always on the outside of my body, the lateral side of my hand. And so because you're always referring to anatomical position. So because you're always referencing anatomical position, the location of my thumb as compared to my pinky never changes. My thumb is always lateral to my pinky. And that's very helpful, again, when we're communicating to one another, that I don't have to tell them what position the patient was in because the thumb is always lateral to the pinky, no matter what. The midline is another important structure. It's an imaginary line that divides the body into right and left halves. It bisects the body. So you've got one eye on each side, half a nose on each side, half a mouth, a shoulder on each side, etc. Right and left. Right and left refer to the subjects right and left. So you'll see in this diagram that the right side of the body is in red, the left side of the body is in blue. Right and left are very easy when we're looking at a diagram from behind. The right is on the right side of the diagram, the left is on the left side of the diagram. However, when the subject is facing us, the right side of the patient is on the left side of the diagram, and the left side of the patient is on the right side of the diagram. Think about this by taking whichever hand you write with. So if you write with your left hand, hold a pen in your left hand, and then if you turn around, it's still in your left hand. But if someone were looking at you, the left would now be on the right, and the right would now be on the left. So just remember that we are always talking about the subject's right hand. Superior means above or top or higher than. Inferior means below or bottom or lower than. Again, remember we're always talking about anatomical position. So if this person is standing on their head, it doesn't matter. The head is always superior to the rest of the body. The chest is superior to the stomach, right? The stomach is inferior to the head. Anterior means the front. Posterior means the back. And we don't just mean the back as in the body part of the back, we mean the back as in the whole back side of the body. The whole front side of the body is anterior. So you can have the anterior side of your head, which is your face, the posterior side of your head. Most of us have hair there. Ventral is another word for anterior. I won't use it very often. Dorsal is another term for posterior. Again, I won't use it as often. Anterior and posterior will be what I use most, but sometimes you will see ventral and dorsal with certain body parts or with different animals that walk on four legs. Medial and lateral. So remember this midline, which is in gray. Medial means we're moving toward the midline. Lateral means we're moving away from the midline. And so if you come up here on the shoulder, I'm moving medially toward the midline until I get to the midline. Then I cross over, and now I'm moving away from the midline, so I'm moving laterally. So medial is toward the midline, lateral is away from the midline. This also works when talking about two body parts. So this side of the arm is the medial side of the arm. It's closer to the midline than this side of the arm, which is the lateral side of the arm. It's further away from the midline. So this is the example I used before, where the thumb is on the lateral side of the hand, the pinky is on the medial side of the hand. You can see even in the knee, right, this is your MCL, your medial collateral ligament, Your LCL, your lateral collateral ligament, is on the outside. Proximal and distal are two other terms that we use only with the limbs. So these terms are only for your arms and your legs. And they're comparing one part of your arm or leg to another part of your arm or leg as compared to the torso. So the torso is here, right? Or the trunk, either one. That's right here. So think about it as a CPR dummy that doesn't have any arms or legs. This is the torso. So we're talking about here. The attachment of the arms to the torso is the shoulder. The attachment of the legs to the torso is the hip. So to get closer to the torso on the arm is to get closer to the shoulder. So I am moving from the fingertips towards the shoulder. I'm moving proximally. If I'm moving from the toes to the hip, I'm moving proximally. If I'm moving from the shoulder down to the fingertips, I'm moving distally. If I'm moving from the hips down to the toes, I'm moving distally. We can also use this to compare one body part to another. So if we look at the lower limb, the knee is proximal to the ankle. It's closer to the trunk than the ankle. But the knee is distal to the hip. It's further away from the trunk than the hip is. So superficial means near the surface, and deep is more internal. If you have a superficial relationship with someone, you have a very surface level relationship with someone. As opposed to having a deep relationship with them, you have much more, I don't know how to say this besides saying deep. It's not just surfacey. It goes further. So if we were to look at this as a cross section of an arm or a leg, you have the bone in the very, very middle. Muscle surrounds the bone, and then skin surrounds your muscle. So in this case, the most superficial part would be the skin. The deepest part would be the bone. And then the muscle is in between. So then you could say the muscle is superficial, closer to the surface, as compared to the bone. And the muscle is deep, further internal than the skin. So the muscle is superficial to the bone and deep to the skin. The bone is the deepest part of this diagram, and the skin is the most superficial. Unilateral means on one side. Bilateral means on both sides. So the stomach is a unilateral organ. You only have one stomach, and it's on the left side of the body. Bilateral would be on both sides. So these are things like arms, legs, eyes, ears, as long as you have both of them. Now, if someone had one arm amputated, they would be a unilateral amputee. If they had to have both legs amputated, they would be a bilateral amputee, on both sides or on one side. Next, we have ipsilateral and contralateral. Ipsilateral means on the same side of the body as compared to the midline. So these would be two right body parts or two left body parts. So you have, in this case, the right shoulder and the right hand. Remembering that we're talking about the patient's right. That's why I said this is right, even though it's on the left side of the diagram. So this is the right shoulder and the right hand. These are ipsilateral. So if this person were to hurt both of these, they would have ipsilateral injuries. On the opposite, right? Contralateral means opposite or against. If you contradict someone, you go against what they say. And in this case, we have the right shoulder and the left hand. So they have contralateral injuries. This can be important because say someone hurts an ankle and now they have a hip injury. Well, is it an ipsilateral hip injury or is it a contralateral injury? And knowing which side it's on will help us determine cause. So we've gone through all of the relative terms or directional terms of the body with the exception of the planes of the body. So a plane, you can think of it as kind of like a plate of glass, if you want, that bisects or just cuts something, it doesn't have to be even. So it can shift in any direction, left or right or up or down. These are going to be perfectly in the middle. So the sagittal plane runs from front to back, and it splits the body into left and right. The transverse plane splits the body into top and bottom halves. And again, it doesn't have to be halves. So if this was kind of like a hula hoop, I can pull it up around the chest. I could drop it down to the ankles. It doesn't matter. It's still the transverse plane. The frontal plane is also called the coronal plane. I will use either. Usually I'll use frontal, but coronal comes up fairly often as well. The frontal plane goes from left to right, but it divides the body into front and back, anterior and posterior. So if you look at them all together, you can see that they're in different directions. Again, they don't have to be perfectly in the middle. These just happen to be. This is really important when we're looking at something like x-rays or MRIs. We might get a sagittal view, means that the MRI cut it from front to back. So we're looking at it, as we're looking at it, we're looking at slices that go from medial to lateral or from left to right. So we have sagittal, transverse, and coronal planes. The last thing to be aware of is how to use the terms of direction. I've been using them throughout, but you can use them in 3 different ways. You can firstly describe where something is located. So you might say that the nose is located on the anterior part of the head. The nose is on the front of your head. You can use it to compare 2 things. The elbow is proximal or closer to the trunk as compared to the wrist. The elbow is proximal to the wrist. Lastly, you can use it to describe how you're moving. If you're moving from the wrist to the shoulder, you're moving proximally. You're getting closer to the trunk.